Hello, everybody. Dr. Jackson. I'd like to thank everybody for tuning in again for this mental health series. Today, we're going to discuss post-traumatic stress, what it is and what it isn't. First, I'd like to thank everybody again. The reason for these series is because mental health has been such a topic lately that everybody just runs up and says, hey, I want to talk about mental health. Being that I've been a counselor in the state of New York for over the last 15 years, I watched the profession grow. And I've watched people that have a platform, and they have a lot of listeners, hundreds of thousands of listeners, even millions. And I listen to them sometimes. And when some of them started getting into the area of mental health and discussing diagnosis and symptoms of mental health issues, some of them were kind of accurate. They read it, but they had no credentials or nothing, that could substantiate what they said. So no matter what state you're in, if you go to a licensed clinical social worker, a licensed master social worker, a psychologist, a psychiatrist, a licensed mental health counselor, and they get to telling you some diagnosis, 9 times out of 10, or all the time, it's going to come from this book, the Diagnostic Statistical Manual of Mental Health Disorders. This is the Bible of mental health disorders. And just like any preacher, why would you go to one preacher, congregation in church, and not another's? Close to your house, you like the preacher's charisma, you feel you connect with him. This is the same reason why we go to mental health practitioners, is because we connect with them. And I've heard from being in the business for so long, I've heard, Dr. Jackson, the reason I come to you is because you connect, or I come see you because you're relatable. So as we get into this post-traumatic stress disorder, I'm going to read it directly from the book and where that comes from. First of all, we have to understand what disorder is associated with post-traumatic stress. Well, first of all, it's coming from what it says. It's trauma-related. So when you say post-traumatic stress, you're talking about a trauma-related disorder. So what is a trauma and stress-related disorder? The definition says it's a disorder that includes the exposure of a traumatic or stressful event listed with specific diagnosis criteria, which means it's certain criteria that has to be met for you to say you even have post-traumatic stress. We know a lot of people have been through trauma growing up as children, such as abuse, violence, the witnessing of those type of traumatic events. It goes on to say this includes reactive attachment disorders, disinhibited disorders, social engagement disorder, post-traumatic stress, and acute stress. What does that mean in layman's term, or so I can relate to you? It's that it's an area with these diagnoses that we call differentials, such as I went out of the country and I had to have a COVID vaccination, make sure I was cleared, or be tested rather. And when I came back, everything was good. Then I went on another trip, and in between that and the surge of COVID, I wound up getting COVID. I came home, I was sick. I did their protocol and I got better. 3 months later, I got sick again. When I went back to the doctor, they said, this time you don't have COVID. It was the flu. But the flu, based on me not being an MD, the flu, it can mimic COVID. But so the doctors had to do certain tests to come up and find out that, hey, it's not COVID, it's the flu. Same thing with these disorders. What differentiates acute stress and post-traumatic disorder? It's the duration, how long it's been happening, and things of that nature. So it also goes on and says, what's the relationship between anxiety and even depression? It's the criteria that holds them together. So this distress of a traumatic event is quite common, and the symptoms include anxiety and fear-based content. It is clear, however, that many individuals have been exposed to a traumatic, stressful event. Rather than being fearful and anxiety, they show characteristics of these. So someone that just came home from jail, and they've done extensive amount of time, and the doors are slamming, and all of a sudden they hear a loud bang, and they kind of get shot. Or the veteran that's been in the war, in the theater, in a war zone, a car go back and backfire, and he reacts to it. I hear a lot of people saying, police harassment. If you can go to your doctor or your mental health therapist, and you guys go through the criteria that meets for post-traumatic stress, by all means, if you suffer for that, meeting all the criteria, specifically criteria A, you have it. Again, as we move forward, we're going to go to, now that we could identify what it is, and if someone has it, we're going to say, okay, she or he has post-traumatic stress. What's the next step? Now that we've identified exactly what the traumatic event is, we have to go on and say, okay, how can we cope with this? How can we work this out? So it can be done in family sessions. It can be done in group therapy. It can be done in a lot of different ways with that intervention. So again, from the war veteran to the 9/11 victim, to even the police officers that see trauma happen on a regular basis, daily. These are the things where, because people say, hey, I have post-traumatic stress. If this criteria is met to be a stress and trauma-related disorder, that's where it goes. So again, I said the following criteria must be met. A person must, 1, directly experience this traumatic event. 2, witness it in person or as it occurred. So if you were the victim of rape or of a gun shooting or watch someone get killed, you're starting to fall in line and say, I think I have, post-traumatic stress. 3, learning of this traumatic event that occurred to a close family member or a close friend actually threatened your life or your environment. Experience or repeated extreme activities that detail this traumatic event. Again, as we pointed out earlier, this is a trauma-related disorder. So when someone says, hey, I suffer from PTSD, understand, we're talking some real serious stuff, man, some trauma. So when someone comes to you as a therapist, clinician, and says, I think I have post-traumatic stress, ready up. They're going to tell you some trauma. A client spoke to me the other day, and we were discussing things. He said, Doc, it was kind of, it took a while for me to build a rapport with you because I'm about to let you into my life. So again, I'm going to go back to this. When my back hurts, I go to my chiropractor. I don't go to my dentist. If I need a plumbing job done, I don't go to my mechanic. So in other words, sometimes we get comfortable staying in your lane. And also what I've learned being in this business is that I don't want to be the smartest person in the room. The know-it-all, smartest person in the room allows no time and no room for growth because they know it all. It kind of intrigues me when a client sees me for the first time and they tell me what their diagnosis is before I even say anything. Because I want to know, by what ground did you draw this conclusion? And sometimes they want to say that, they've done it because they went extensively done some research. So I'm like, wow, okay, I like research. So since I love research, I say, I'm thinking, what did you use? Qualitative, quantitative, or mixed method research? And they say, no. I Googled it. My dissertation wasn't based on a Google search. A Google search is a Google search. Research has a complete different definition. But again, for those that don't know, they think, going on the internet and looking up a couple words that, hey, I spent a lot of time last night doing research. Back to PTSD and the criteria. So it says, once these intrusive thoughts and these are symptoms that associate, now watch this, you have symptoms and you have features. These mimic, I can sneeze. Does that mean I have the flu? Does that mean I have a cold? Or that mean I just sneezed? See, there are criteria that's going to lead you to this. So this recurrent event is also involuntary and intrusive, distressing memories of a traumatic event. Did you catch that? So when you're living this thing, it becomes out of nowhere intrusive and distressing memories. Did y'all catch that one? Okay, now, these recurrent events, they affect you. And they also can be related to dream trauma. You can't even sleep. You know, then that goes back into the severity of all the disorders with anxiety, depression, and post-traumatic stress. Do you need medication? Do you need to be hospitalized? Because it's mild, moderate, severe. It could be somebody, every time they hear tapping, every time they hear something, they're jumping, they're fidgety. Because that post-traumatic stress is that severe. Especially those veterans coming from combat zones. Some of them never recover from that. People that have been sexually assaulted, what it is, we bury it. We dig it, get a shovel and we dig deep and we try to bury it. But at certain times and in certain places, these features, it comes out. So before you say I have post-traumatic stress, read the DSM-5. Read what the features are. So when you go see your mental health doctor or your therapist or even, get medication for that, you'll have a greater understanding of what it is. And again, once this is identified, how do we deal with that? Family could be involved. Your loved one could be involved. Couples therapy. Sometimes it's not about just an intimate relationship with you and your partner. Some old issues may have resurfaced in the relationship where going through this traumatic event, you might have to bring your partner with you to walk through that. The next step to having or identifying post-traumatic stress is now we have to see what intervention could be used. For some people, group therapy. For other people, individual therapy. For others, it could be, EBT or DBT or CBT, which is cognitive behavioral therapy and trauma-related therapy to help you cope with this. Sometimes family therapy is needed because that 9/11 victim, it kicks that up again. And we all, witnessed 9/11 and we watched the effect that it had on everyone. So again, understanding the criteria around post-traumatic stress. And this mental health series is set up basically for people to get a greater understanding of what it is. And I know we're people of nature and people of habit. And you might see a doctor sometimes if I wear a doctor suit. If I go outside of my suit and my shoes, somebody looked at me one day and said, Doc, when I see you dressed like that, I kind of get intimidated. So sometimes I try to meet the people where they're at. And we're going to finish this series on post-traumatic stress, and we're going to go into intervention and how, we can help each other come past this. So if you've experienced post-traumatic stress or you think you've had, drop a message, drop a line, respond. This is part 1 of post-traumatic stress. We're going to finish this up in 2 more parts. So this is the first part of this post-traumatic stress.